And good evening again. Welcome back to Bite-Sized Learning. I am Dr. Mike Sevilla, OAFP President, and we have a great show for you tonight. But before we get to tonight's fabulous guest, I just want to mention just one thing. Tonight kicks off, or as you watch this kicks off Wellness Week here at the Ohio Academy of Family Physicians. What is that? We have some great topics that are coming up that you can either enjoy live or on demand. So don't get all stressed out if you're not able to watch these programs live. We anticipated that. You can get all the information at ohioafp.org, and we're eventually going to have a big old banner on the front page. You'll be able to just click on it, see the schedule. And in general, these programs are in the afternoon live, but again, you can also watch it on demand on Facebook and on YouTube. So, all right. So we're gonna just let's bring in our guest. Let me just introduce him, Dr. Michael Holliday, Medical Director, the University Health Services, and Associate Professor of the Department of Family and Community Medicine at the University of Cincinnati. So, good evening, and thank you for joining us.
Great to be here. Thanks so much for the opportunity.
Now we're going to, you do have some slides for us, which we'll get to, and I'm really looking forward to the content. But just to kind of introduce yourself to our audience, so my first question is, where did you grow up, and how did you find your way to medical school in the first place?
Well, was born in Canada and then lived in Indianapolis for a number of years, and then moved to Cincinnati when I was 13. And when I was 13, that's when I first started thinking about becoming a doctor, actually. I had some friends that were interested in science, and I was in a really good school system, very fortunate, thanks to my mom and what she did for my brother and I. And then I thought, well, maybe I could be a doctor. You know, I like science, I like to help people, and so that's how the journey started. And here I am many years later.
It's something that I always love asking family docs is, how did you find your way to family medicine in the first place?
I think for me, I don't think this is unusual, but I'm a somewhat indecisive person.
Yes, me too.
Yeah, so I feel like I'm an eternal I'm eternally stuck in medical school, and I feel like being a family doctor is just my way of continuing my medical school education. I didn't want to say no to any patient type, any disease, type. I kind of wanted to be part of it all, and I'm constantly learning, and I enjoy working with other people, in my office and also in other parts of our healthcare system. So family medicine really suits me well for those reasons.
And what is can you describe your current practice situation now? I know that you work in academics as well. Can you kind of paint that picture for us?
Well, I call myself a recovering primary care physician and a recovering leader. So as you will see in a few minutes, I had a rough spell of burnout myself, and then landed on my feet in a different clinical environment. So now I'm working in college health. And I started to take on some leadership roles over the past 3 years, and that culminated in becoming the medical director since our past medical director just retired. And I'm very thankful. I worked with a great group of people. The students are amazing. The other providers I work with are great. And I find myself in another chapter of practice transformation that we're all working through together, and I'm really having a good time. And I think I'm doing it in a way that will decrease my chance of burnout in the future. I've learned a couple things.
Yeah, I mean, this topic tonight, and we can bring up the slides. This topic tonight is just so resonates with a lot of people, including myself. And I'm really looking forward to hearing your story here. So why don't you just go ahead, and I'll try to stay out of the way as much as I can.
Okay, thanks a lot, Mike. Well, thank you, everyone. Welcome. I wanted to open up the discussion just to say if anyone here is struggling or needs some additional resources, OAFP has gathered many great resources to look at. One in particular I wanted to bring up today is the Physician Support Line. If you find yourself struggling with feelings of burnout, struggling with depression, and feel like you need to talk with someone, certainly reach out to a colleague, friend, family member, but you can also reach out to the support line as well. It is managed by volunteer psychiatrists, and I think they have hours all the way up to 1 a.m. So with that, let's get started. I'm going to take you back to 2018, at which time I had an integrity problem. Now, I don't mean that I was going to lavish drug-up dinners or anything like that. That was actually in the early 2000s. I don't do that anymore. But what was really going on was that my outside did not match my inside. On the outside, I was vice chair of our department in clinical operations. I was medical director of a successful practice, principal investigator of a large MedTap grant, and always had a smile on my face. But on the inside, I was a hot mess. I was feeling inadequate, felt like I just could not keep up with everything, was constantly comparing myself to other people. And as a result, I felt like I was a bad doctor, bad leader, bad teacher. And of course, I was so busy and not always present for my family. So I felt like I had let them down as well. And a day came along in February that kind of crystallized how I was feeling. It started off with a patient in the morning who had a chronic disease. I'm going to change a couple of details just for HIPAA reasons, but this patient had a chronic disease, and he had some cellulitis on the foot. I thought, well, no big deal. I'll take care of this myself. I'll look up in Sanford how to take care of it. Maybe I'll send this person to wound care. And then I realized that the real problem was a metatarsal exposing ulcer on the foot. And at that point, I started to feel, bad for the patient. I thought, oh man, this is going to be really hard for him. And but then I felt some other things that really disturbed me. I felt bad about myself. I felt like I had failed somehow. I must have not managed this person's condition well enough, and that's why we were here. And then I felt even worse feelings, if that's possible. I was reminded of the quality metrics that we were being looked at under in the CPC Plus initiative, which included Medicare expenditures. And I thought, well, this is a avoidable complication of diabetes, right? So like I screwed up. This is going to be on my numbers. I'm going to get dinged for these horrible Medicare expenditures. And then I felt bad about feeling bad. I thought, well, like, who am I? This person actually has the disease and I'm feeling sorry for myself. I think my therapist has called that meta bad, when one feels bad about feeling bad. So it was bad all around. And this, I got through this case, got the care that this person needed. And then I was rushing to a meeting with a representative from Center for Medicaid, or for Medicare and Medicaid Services. I was tasked by my healthcare system to just say how CPC Plus was going, what I thought about it. And I was pretty upset during this conversation. I said, I think it's a great program. I'm really encouraged by some of the system-based changes that are happening. It's awesome. It's great that this is taking place. But I also said, I think in some ways we're not all on the same page as to how challenging quality improvement is. And I thought that maybe some of the ways that we were doing it as a country was almost turning into gasoline on the burnout fire. So in the process of trying to make things better, we're actually making it a little bit more frustrating. Now, ironically, I was late for a psychotherapy appointment and to deal with the burnout that I was experiencing. And before I left, my medical assistant said, Dr. Holliday, you can't go. So-and-so can't get their CAT scan unless there's a peer-to-peer that is done. And again, I'll change some details here as well. And it turns out this person had already had some imaging studies, a specialty evaluation, and had invasive testing. And the only thing that had not been done was advanced imaging like a CT scan or an MRI. There's really nothing else to do. And this person had a very serious problem that was not getting better very obviously. And I went ahead, did the peer-to-peer. I talked with a doc, and I just shared exactly what I had documented that they already had. And they said, well, that sounds fine, Dr. Holliday. We'll go ahead and approve it. The numbers, 10 digits, write it down, whatever. So I thought this is just a waste of everyone's time, very discouraged. So I'm rushing late. I go to my psychotherapist's office, and I share with her what's going on. And she said, Mike, for the first time, I'm kind of encouraged. And I said, what are you talking about? I feel miserable. And she said, this is the first time that you seem kind of angry. It's the first time that you've not blamed yourself for everything. And I think maybe that's healthy. you have some things that you need to work on. We've talked about that here, but the system has some things too, and it's probably good to have a balanced view of it. So I think that was the first time that I started accepting what was going on, and my acceptance continued into what I call the Radical Acceptance Tour. The date of this tour, the start date was March 20th, 2018. And I found myself in a meeting. It was in person. It was prior to COVID, and it was a chair level meeting, and all the division directors were talking about things, and I was just struggling that day as usual. And I noticed that one of my colleagues, who's a psychiatrist, was in the room, and I thought I will take him aside and ask him some questions. So I said, Chris, do you know any good psychiatrists? And it turns out that the good psychiatrists, if you ask them that question, they will ask you follow-up questions like, what's going on, Mike? And so I said, man, I've been feeling pretty bad. This is how I feel about myself. And he asked the right question. He said, Mike, that sounds rough. Hey, sometimes when people are feeling this way, they start to have some suicidal thoughts. You've been struggling with that? And I said, yeah, I have. I mean, not now. I'm safe now, Chris. But, like a year ago, I was struggling. And he said, well, Mike, today's going to be different for you. It's going to seem really weird, but we're going to take care of you today. It's going to be weird. But here we go. Do you mind if someone else comes in the room and helps us out with that? And I said, well, how about Barb Tobias? So she came in the room, and I told her how I was feeling. And then she helped me get like a field trip to the Linder Center of Hope, which is an outpatient, inpatient mental health care facility just north of Cincinnati. I got to ride in her Prius. And when I got there, I had an epiphany. I went through a partial hospitalization program for 2 weeks. This is where I was safe enough to go home, but not functional enough to go to work. And my epiphany did not come during the group psychotherapy sessions, which were helpful, or the one-on-one psychiatry appointments, which were helpful. My epiphany came during craft time, during which I found myself making an Easter basket with tongue depressors at craft time.
That was fun.
Yeah. And I was like, and just like the perfectionistic, the maladaptive perfectionistic person I am, I don't think mine was finished in time because I was trying so hard to make it perfectly. But anywho, I thought, here I am. I have to admit that things are not right now, and I am making an Easter basket with tongue depressors at craft time. There's no denying that I have issues. And I thought, but I don't want to come back here again. I mean, it's a great place, but if there's anything I can do to prevent this from happening, I need to figure it out. And that's when I realized I needed to figure out like what were my issues and what were maybe the external issues, the system issues. So I went on a journey to try to figure that out. And I like the analogy of the canary in the coal mine. And in case there's any confusion, I am the canary in this analogy. And when it comes to this canary had some issues, just like we all do. And I had a set of core beliefs, which we all have, our core beliefs that kind of influence our behavior and our thoughts. And mine probably, I picked them up a long time ago, and they served me well enough to get into medical school. But they stopped serving me, 20 some years into my career. And these included this idea that I was an outsider. I needed to prove myself. I also had this thought that I was responsible for every outcome. And so the outcomes really were quite a judgment of my worth, I thought. My value was determined by the thoughts and feelings of others. And so if people were upset with me or they didn't like me, I felt, less than. I also often assessed my value by comparing myself to others. Again, that worked in the first years in med school, but not very helpful once one is an attending physician surrounded by brilliant people. And I also thought that I was only as valuable as I was helpful or smart or funny or whatever. And this led to some really unworkable rules in a busy primary care academic practice. So My unworkable rules were many. Here's just a sampling. I can leave the exam room only when I have done everything I can. That raised some eyebrows of my therapist when I shared that one. The suffering of others is intolerable, and I must act to stop it. That was difficult when I was dealing with chronic pain patients on opioids. I must act. I must avoid conflict at all costs. If something bad happened, it is my fault, and I must always know the answer. So these were not very sustainable. Well, before I completely judge myself, we need to look at the coal mine. And I take the advice of this gentleman, W. Edwards Deming. He said, if you want to judge someone, I think including yourself, you must solve this equation first. And this is individual input plus the individual interacting with the system equals the total performance or outcome. And he said, if you want to judge someone, you got to solve this equation. And oh, by the way, every sixth grader will tell you it is unsolvable. So with that, let's try to tease this out. So the system has its issues too. And when we talk about the system, I'm really talking about maybe your local work unit, your healthcare organization, and then the policy that you're influenced by day to day at the state and national levels. And we know that our job can be difficult. If you had a 2,000 patient panel and it was just up to you and maybe a clinical support person to take care of the acute, preventative, and chronic care needs, this would take over 18 hours a day. But that's great because that leaves 6 hours left for for whatever EHR you use. And I don't want to slam a particular EHR. And we know from the article tethered to the EHR that the average physician is spending about 6 hours of time, both in scheduled visit time and also afterwards, so-called WOW, which is work after work. And to summarize what it's like to try to provide really good care and a good patient experience when we sometimes don't have the resources we need, I thought that this quote from an internist was quite good. If you hear that noise, my daughter is taking a shower in the background. Sorry about that. The role of the primary care physician is to create the illusion of a seamless healthcare system for the patient. So I learned a couple things on the way. Hope that background noise isn't too much. I learned a couple things on the way. One, I learned that blaming does not work. So as I went about trying to figure out how to improve my situation, not be burned out, and maybe help the system along the way, I realized that blaming myself completely or blaming the system completely was not helpful. And I learned this from a book, an author, and also counselor. She said that instead of having a completely internal locus of control, you may want to have an accurate one. You know, think about what are some things that maybe you need to work on, but what are some external factors that are going on too? If I have a completely internal locus of control, that means eventually I have to apologize to you for the weather outside, and that would be crazy. So I don't want to do that. I also learned some things about how to deal with failure, not to blame myself too much, and also not to blame others. Now, many people tell me, Mike, don't call this a failure. What happened? And I tell them it's okay. You know, if you read this book, Rising Strong, she brings up the fact that if you're working on things that are really important to you and that are challenging, a great sign that that's happening is that you're going to fail sometimes. And she recommends looking at failures in a way that you can learn from them, grow from them. And one way to do that is not completely blaming yourself and also not completely blaming others, but having a kind of a more sober judgment and maybe a kind view of things for yourself. I also learned that avoiding burnout does not work because I spent a lot of time trying to do that. I mean, I made a lot of good smoothies. I went to yoga class. I did mindfulness stress reduction courses, but I was doing a lot of it in the effort of avoiding something. And Russ Akoff, who was a systems expert for Deming, he said, an improvement program must be directed at what you want, not on what you don't want. And he said, if you want to prove that, all you need is a remote control, a couple of hours, and no idea what you want to watch. So you just kind of change the channel if you see something you don't like. Well, now with Netflix, you can literally do that in like 3 hours. So we have to figure out, of course, we don't want burnout, but what is it that we want? What can we actually proactively move towards and actually affect change with? And the Institute for Healthcare Improvement suggested the word joy as something to go after. And some people are turned off by this term. I've seen it called other things, engagement, wellness, but it's basically something that's positive and has to do with enjoying your work, finding meaning in it, and having it be sustainable and hopefully helpful for our patients. So just Aaron Antonovsky said that health is more than the absence of disease. IHI observed that joy is more than the absence of burnout. One thing about this joy that we're trying to create, it is a shared responsibility. So we can't really rely on just the internal resiliency efforts of folks. And we also can't completely rely on system leaders to make the perfect working environment. I myself have to work on my resiliency. I have to work on my sleep, for example. I recently got in a car accident because I fell asleep at the wheel. So that was a lesson. So we need to work on those things. And I also need to be engaged in whatever improvement efforts that are happening at the system level. So if there's maybe a quality improvement effort that's going to make team-based care more of a reality, eventually make my work more effective, I need to get in there. I need to work on it, even if it's challenging. And likewise, system leaders do need to make some changes, in particular because burnout, we know now, is primarily a systems issue. People in the healthcare professions, they enter probably more well-adjusted and mentally healthy than their average college graduate counterparts. But this trend is reversed by the second year of medical school. So there's obviously a lot of system issues going on. And we'll look at both some individual issues and system-based issues in the next couple of slides. We're almost finished here. So as we try to improve joy in our work, one of the most important things we can do is what Amy Edmondson termed framing our work. She said to get people on the same page, in this case, the individual healthcare team members and system leaders, we need to have common goals and a shared appreciation for what we're up against, kind of the good, the bad, the ugly. And she calls this framing the work. And framing can be asking a few questions. Is this work that we're doing meaningful? How is it meaningful? How is the patient served by what we're doing? Do I have the resources that I need? And does this work that we're doing, does it make sense? Do the quality improvement efforts that we're doing, the data that we're giving, does this actually make sense and make things better? So first to the meaning part, is my work meaningful? We need to figure this out because this is probably the most important place to start. It's kind of our why. We want to start with why. Rachel Naomi Remen said that meaning is the antecedent of commitment and satisfaction. And Viktor Frankl, who suffered the atrocities of Auschwitz, said that those who have a why to live can bear with almost any how. So is my work meaningful? And sources of meaning for healthcare providers include our relationships with our patients and our colleagues, feeling like we're getting good at what we're doing, the intellectual stimulation of a challenging job, which we've certainly all elected to participate in, and then opportunities to help heal and reduce suffering. Unfortunately, there can be some barriers to meaning, and there's opportunities for both the individual and system leaders to make work more meaningful. For the individual, you can ask yourself, what matters to you? And the reason why what matters to you is an important question is one study found that providers who had, or physicians who had 20% of their time allotted to something that they thought was personally meaningful, their chance of getting burned out was much less. So what matters to you? What is your 20%? And then also, what is getting in the way? What are the pebbles in the shoe of everyday work that make it hard to do what matters to you? And then what's in your control to make it better? Maybe some of the system-based changes that are that are needed aren't here yet, but there's maybe some things that you can do to make your work more meaningful. So finally, there's that question of what's your 20%? And then for system leaders, the IHI recommends that they ask the staff, including the physicians, what matters to them, and also looking at what seems to be getting in the way. We can use process improvement to support meaningful work, and we can also invest in our workforce to make sure that they are putting in 20% of their time into something that they find meaningful. And also, we need to acknowledge that there are sometimes discrepancies between espoused values such as patient-centered care, social justice, and what's actually happening in daily practice. And it's not because people are evil or they're a villain or whatever. It's just that just like individuals have room to grow, organizations have room to grow too. And it's helpful to admit where we need to improve. And then, is my work manageable? So let's say I found meaningful work, but I need to be able to do it. So I need adequate internal and external resources to manage work. And on the internal resources, one can ask themselves, how full is my tank? And I think of two areas. Of course, the body and the mind are interconnected. But on the body, am I getting enough sleep, which I didn't last week, but I'm better now? Am I eating a good diet? Am I hydrated? Am I doing exercise? And we know that physicians as a group are not doing well in kind of all of these areas. And that has an impact on our mental functioning. And then also our internal resources, just mentally, emotionally, spiritually. What's my mindset? Am I fully present when I'm doing my work? So we'll talk about the mindfulness and mindsets a little bit. We hear about mindfulness quite a bit. It seems to be mystical. Some people might get the idea that that's all you need. And I look at mindfulness as just a skill to practice, and it seems to be a keystone practice in a lot of disciplines, whether that is something like prayer, or it's something like trying to do meaningful work in a flow state. Maybe it's working on emotional difficulties. So there's mindfulness-based cognitive behavioral therapy. So it's basically whenever it would be a good idea to be fully present and in the moment. And it turns out that when people are not fully present and in the moment, they're not happy. So they've done studies showing that people, if no matter what they're doing, if they're not fully present during that activity, even if it's a pleasant activity, they're less satisfied than they would be had they been actually fully present and not distracted. And then I also recommend for myself and others to do what I call updating the programming. I think a lot of us got into medicine with some maladaptive perfectionism at times, some imposter syndrome, sometimes thinking that if we don't accept ourselves and beat ourselves up, that gives us an edge to perform better. Hopefully I'm not the only person that sounds kind of crazy, but these are things I struggle with. And we know that it's helpful to have a different mindset than that. So, for example, does someone have a growth mindset versus a fixed mindset? Do I see the challenges of my day as opportunities for growth, or some type of a judgment against myself that I don't have what it takes? And if I don't accept myself at my present skill level, and I'm thinking about myself, and I'm thinking of how I'm inadequate, let's say in a meeting or in a patient encounter, that actually prevents me from serving the person that I am trying to serve at the moment, because I'm thinking about me. I'm not thinking about them. I'm not bringing the skills that I do have fully to the table. And then another thing that I can work on in terms of getting my mental, emotional tank full is looking at this idea of self-compassion. Kristen Neff, you may have seen her TED Talk. She talks about the importance of being mindful, noticing when you're struggling with something in life, and then realizing that you're not alone. It's part of the human experience to have struggles like this. and also then to do something for yourself as if you cared about yourself. And that might mean the tough love of stopping procrastinating, or it might mean taking a break or getting counseling or whatever it is that you need. So this practice has been shown to be particularly helpful for people who are struggling with things such as burnout. How about the external resources? We cannot resiliency our way through this thing, as I've heard people say. And so what about this system, this coal mine of ours? We do need to change systems of care. We know that the outcomes that we want for our patients and also the experience that we want for the healthcare team can't happen unless we're changing the systems of care, including increasing team-based care, reducing clerical burden that we find in the EHR and administrative tasks that we do, and also improving general workflows so we have a more efficient process in our office. And that's just a reference again to this illusion that we sometimes try to do. So now on to making sense of our work. So we talked about our work's meaning. We talked about trying to make it manageable. And to frame this work we're doing, we have to make sense of it. And I'm going to share a model with you that has been helpful for me to make sense of our work, especially for our quality improvement work that we're in, which again, I found to be sometimes gasoline on the burnout fire. And I want to preface by saying that all models are wrong, but some are useful, as George P. Bach said. But the model I'm going to share with you has been used by the Institute for Healthcare Improvement and also some pretty smart people, such as Don Berwick and the writers of the Improvement Guide. And that model is Deming's profound knowledge. He said, if you wanted to improve anything, you need to have this idea of profound knowledge happening, where you take into account some complex things, because we live in a complex world and it's difficult. It's difficult to make real changes. And we need to be thinking about things such as a system that we're working in, variation of data that we see, and then how do we actually learn, and then also how do people's minds work. So I'll talk about that a little bit. When it comes to psychology, this is just how people's brains work, because we are working with people who have brains. We are not logical, we are psychological. And examples of that include, people want to do a good job. They're not trying to make your day hard. So sometimes we think that if something's not going well, people just aren't working hard enough. That's really not true. People will not engage if they are afraid, even if that has a cost in terms of a patient experience, because they just don't want to look stupid. They don't want to be a bother. They don't want to seem needy. So people may not speak up when it's really needed for team-based care. And also, the stuff that we're asking our patients to do every day in the office and things that we're asking our team to do, all this behavior change, it is not easy. Just try it yourself. It is challenging to do. We also need to be thinking about this idea of system-based work. We work in a complex system, and we may have an idea of something that could work, and it might make something better. But if we don't think about how that thing contributes to the entire system, it could make the whole system actually worse. And I know everyone on this call has seen this happen before. There's an email that's sent from on high on some change that seems to make things better, and we realize that it actually had an unintended consequence that was kind of frustrating. And then this idea of understanding variation. We are constantly bombarded with data, but that data is not always meaningful. And sometimes it's not useful, and we can get confused. So as we get Excel spreadsheets sent to us with like red and yellow and green in terms of who's doing well and who's doing bad, some of these changes for the better or for the worse can be random, and we can react to those changes, and actually it can be not helpful, or we can inadvertently kind of blame ourselves and say that we're doing something bad when nothing bad has happened at all. A great example of this is patient satisfaction data. Most doctors don't have enough surveys to make any sense of month to month variations in our patient satisfaction data. But yet we often feel like our grade has gone down. So maybe I had 95% of my patients love me 1 month, and the next month it's 85, or was I 10% worse? Probably not. And then finally, this idea of how does learning actually happen? How do we make sense of trying to improve the system? And here, I find a lot of people, including myself, wanting to use common sense. But as systems get more complicated and our problems become more complicated, oh, whoops, sorry about that. I just realized my mic was being blocked. Sorry. The problem is it's hard to make intelligent changes unless we test them. So this is where the dreaded PDSA cycle comes in. So instead of using common sense, we actually have to gain new knowledge through a process. And also during this process, failure is feedback. And so we need to be open to when we try to make a change, but it doesn't work. So I'm going to close here and challenge the group. Just ask you a few questions. One, how are you doing? What is your 20%? And if you were a leader or have some type of leadership role, how could you make work for yourself and others more meaningful, manageable, and comprehensible? And then also, where do you and your system leaders maybe need to get on the same page? And that is all I have. Can you hear me?
Okay. Yeah. I didn't know if you had one more slide after that. So
No, that was it. I should have put the end.
That's okay. That's okay. Well, I guess my first question for you is, how are you doing these days versus when you kind of started this process and kind of your discovery process?
I'm doing very well. I've learned a lot from the process, and I've tried to make the system better, not only for myself but my colleagues and my patients. So I've put some efforts into looking at what are some of those system changes that can be helpful. So I've done some work there, and I'll be sharing some of that tomorrow, I think.
Yes, you'll be coming back tomorrow, I think around 3 o'clock, and you're going to be having a whole hour on that topic, which I'll be very curious about. Well, what I get questions on, or even myself, what I feel is that, and you talk to a lot of docs too, Mike, is this just how we feel. Mm-hmm. How we feel when we get these kind of nasty grams or these emails or we run into this patient that just happens to kind of trigger us in a bad way, and that kind of gets us spinning and all that. When you talk to docs and when you talk about like trying to before you can really kind of change a system, you really kind of have to be really aware of your own, what's going on with you, and kind of try to settle, kind of know what's happening with you before you can really kind of really go forward to make changes in the system. Do you have any insights or advice for docs who really just want to start with themselves first before they can really project and really go out and try to make some system changes?
Yeah, I think what's been helpful for me, and also when I've spoken with other physicians who sometimes confide in me their struggles, a good first step is just noticing what's going on. Maybe it's a feeling of being frustrated. Maybe it's a feeling of feeling inadequate. Anxiety is a common thing I hear from providers as well. And so just admitting where you are, and then thinking about maybe what are some things that are going on personally that you can work on, but also looking at it in the context of what's maybe out of your control that you need to let go of. And not blame yourself for, because I find a lot of people taking everything really to heart as if it's it's all on them. And again, I recommend, like that slide said, to have an accurate locus of control. be really honest about what needs to be worked on a personal level, but don't be cruel and say that it's like everything. So an example I often see is people being frustrated by patient satisfaction data, like their numbers are bad or whatever. And yes, can we find some comments in there that maybe ring true and realize, I need to work on that. I need to work on being more clear with my communication. But I also, don't have to, completely say that this is an indictment of how I actually am as a physician. Like, this number does not mean everything. So that's perspective, I would think.
Yeah, I mean, us as family docs, I mean, we want to do the right thing. We want to do the best thing. We want to give the best patient care. We want to try to fulfill all our patients' requests, and which is totally unrealistic. But like I said, that's the strength, and kind of a weakness of family medicine, is that we get some of this feedback from patients or from the powers that be, as we joke about, and we really, some of us, even me at sometimes, really take that to heart, really very serious, and does this mean that I'm a bad doctor, and what do I need to do? And what you're saying is that that there is a sliver of truth to some of that, but don't take all of that in. I'm really, as people know, I'm really big on social media and things, and that's what I tell people too, is like, when people kind of search to look about me, I mean, there's going to be really bad stuff, and then there's going to be really good stuff, and somewhere the truth is in the middle there. Is that kind of where you're going, or is that, am I getting at the right way?
Yeah, I think so. I've heard people call that critic math, where you could be 90 great comments and there's one bad one, and that's the one you kind of stick with. But yeah, just recognizing when and being a little bit too hard on yourself, and then just looking for things that you can actually work on and change. For example, I'm going back to the patient satisfaction thing again. Just because it's a frustrating thing for a lot of people, data wise, when they get that feedback. One physician up in the Mayo Clinic made a good suggestion, which was pulling the data for a work group, because that actually has more power, and you can see how changes within that office or healthcare system can actually have an impact on those numbers, because you have more data. And in our office, what we try to do is look at the numbers, pay attention to them, but maybe pay more attention to the individual comments and see where there's opportunities to make the patient experience better. And also realize that the patient experience is not all up to me. It's really influenced by how I work with my team. And so if there's ways that our whole office can get better, then that's probably going to help patients have a better experience. And and as a side effect, they may give me better ratings, but it's because their experience overall has gotten better.
Mm-hmm, mm-hmm. And I've done this for a lot of years, and you probably just done this for a lot of years. It's just like, I mean, I don't know. I just want to just want to go along just to get along, and I don't really want to just deal with this stuff. And there's a lot of docs out there, and who are just kind of numb, just like, I just want to just take care of my patients and go home, and and they're really kind of perpetuating kind of this false resilience or burnout or that type of thing. I mean, what advice do you have for them just to try to just to get out of this, this bad negative cycle that they're in, and try to get themselves better, or to make some changes in their workplace?
I think a good thing to remember is that physicians as a group are pretty highly functioning people, even when things are kind of falling apart inside. And and that's good on one hand, because our job requires that we are professionals, even when we're under a lot of pressure. But this can be maladaptive when we let things go too far. And so I think the advice I'd give individuals would be, if you sense that you're struggling with burnout, get some time, whether it's a staycation or something, where you can just step back from your practice a little bit and look at what's going on with some honesty and figure out ways that you can get your needs met, maybe ways you need to grow as an individual, maybe some changes that you have to get started on in terms of your office, the way you schedule patients, the way you interact with patients. If there's some resources that you need, could be things like boundaries with patients, or dealing with patient suffering, whatever it is. Realize the needs you have and try to get some help. Because the alternative is to kind of keep going until one day you can't anymore, and that's what I did. And I can tell you how that goes. It does not end well. I mean, it's I've recovered, but it sure would have been better to not go through that experience. And I'd also share this advice with people who are working with other colleagues who may be suffering from burnout. I forgot who it was, but a wise physician said, if you sense that someone is struggling with burnout a little bit, they have been struggling for a long time. So if it's apparent externally, they've been probably struggling for a while. So if you see people acting in a way that just doesn't seem as professional as usual, or they seem to be kind of distant, or they're not as warm and engaging with the staff, it might be a good chance to just take them aside and say, hey, I noticed, things seem a little bit rough lately. How are you doing? What's going on? I think we need to be open to the fact that, burnout does happen. And if we're struggling, a great way to have joy in work is to notice when things are off course and try to move in the right direction.
Yeah, well, one of the things I've really learned during this pandemic is that medical professionals, especially physicians, pre-pandemic really didn't kind of reach out to each other and say, hey, what's going on? Or I've noticed something a little bit different about you, or just want to check in with you. And I noticed that more and more, during the pandemic, just because it was just such an awful situation for many people personally and professionally. And that is great advice that you have, because we tell that to our patients. We say, hey, if you notice a friend or a family member, you should check in with them, and we should really check in with each other. And I've learned that. That's something that I've learned, especially over the past year or so.
I think if we all did what we told our patients to do, we would have amazing healthy, fulfilled lives, right? We're often giving other people just very wise advice, but sometimes we follow it ourselves, for sure.
Before I ask you for your kind of closing thoughts, you did mention that you're going to be moderating a discussion tomorrow.
Yeah.
Why don't you tell the people about that and why they should tune in, and what topics you're going to be talking about?
Yeah, well, as we know, we can't resilience our way out of this burnout issue. So if we want to have joy in work, our system does need some changes, and we know that there's system-based changes that can improve things. I want to share some of those with people, and maybe answer some questions about what can help this process. And I also want to share the story of our College of Medicine at University of Cincinnati. How do we go about trying to improve wellness in our College of Medicine? And it's a process that you can't wait around for a chief wellness officer to be appointed and kind of make everything better. People need to get involved kind of at the grassroots level, and I'll share a little bit about that.
And that'll be tomorrow, Monday, August 9th at 3 p.m. Eastern Time, and on the OAFP Facebook page and YouTube channel. So before I let you go, any other closing thoughts or anything else that has come up, or maybe just emphasize again in your closing remarks, the importance of this and the importance to you personally, and why you shared your story here tonight.
Well, I want to encourage people to have a frame of mind that would be helpful for them as individuals, be helpful for patients, helpful for our system. And I think that includes, realizing not only that this is a tough problem, but that we need to be focused on something actually positive that we need to be moving towards. And we need to work together. Leaders and individuals need to work together to make it happen.
Great. Thank you so much, Dr. Mike Holliday. Thank you so much for being our guest tonight. And I encourage everybody to check out his discussion tomorrow, and also all of Wellness Week here at the Ohio Academy of Family Physicians. Now, don't worry. Don't get stressed out if you can't catch it live. You can always catch it on demand on our Facebook page and on our YouTube channel. Get more information at ohioafp.org. So that ends our discussion tonight. Thanks, Mike, for the time. I really appreciate it. And I know we'll talk more down the road.
It was my pleasure, Mike. And I don't know if I told you this, but you have a great name.
Exactly. And I will refer you better. That ends our program tonight. So thanks, everybody. And get more information at the Ohio AFP website. So good night, everybody.